Well, to tell us more about access to mental health services, I'm joined via webcam by Lucie Walters. She's the President of the Australian College of Rural and Remote Medicine, and she's in Mount Gambier in South Australia. Lucie Walters, were you surprised that people in remote or disadvantaged areas are struggling to get access to mental health services?
No, I've worked here in Mount Gambier for 20 years as a general practitioner for 10 of those, and based in the hospital as a GP obstetrician looking after women with postnatal depression and other conditions for the other 10. And this comes as no surprise to us or to the Australian College of Rural and Remote Medicine. The further away that you get from the city, the less able you are to access clinical psychologist, psychiatry and inpatient care independent of severity of your illness.
What effect is that having on the patients themselves? Has anybody ever done any research to try to quantify this?
Look, there's a lot of work that's been done, and I'm not the expert at the research, but if you look at the situation on the ground in what it means for patients is that if you live in a remote area, you are likely already to live in an area that's got lower socioeconomic circumstances and other social determinants of health like education, health literacy. All of those things are likely to compound your chance of being able to access help for your mental illness. We know, therefore, that mental illness is more common and more severe in rural and remote, and we're not getting the expert help that we need for those people.
Does it actually put more of a burden on GPs? Are GPs actually becoming the primary carers when it comes to mental health and picking up some of that slack from the absence of specialist services?
Certainly, again, we know that people that are in more remote areas of Australia are less likely to access their general practitioner in comparison to people in the city. But the gradient is much smaller. So it is likely that if you have a mental illness in a rural and remote area that you will have access either to a mental health worker or an Aboriginal health worker or a general practitioner. And certainly the general practitioners have a very high percentage of the people that come and see them have mental illness, and they frequently work hard to increase their own areas of expertise in managing mental illness.
Lucie Walters, you and I are talking via webcam this afternoon. What role can technology surely play in improving access to mental health services? Is it not possible to give people access via technology like we're using today, no matter where they're located?
Certainly there's some fabulous examples of that, and South Australia has the state mental health services have been outstanding in being able to increase the access to psychiatrists through video conference. It has an important place in reducing the travel burden, which is both time and financial, for people to access specialist psychiatry care. And it allows general practitioners to have a good relationship with patients, but also to have the continuity they need to care for people, but being able to seek specialist intervention in a timely manner. So it's a fabulous example of how telehealth can improve the lot for rural and remote people, and we need to be increasing the use of telehealth in psychiatry and ensuring that there are no gaps or burdens that prevent it.
All right. Lucie Walters, President of the Australian College of Rural and Remote Medicine, thanks very much for talking to us today.
Thank you.